Hello, everyone. Good afternoon. Today, it's December 4th, the last month in 2023. I'm Dr. Miriam Smith, the host for Empowering New Nurses. First, let me say thanks to all who have supported me during this year. And this year is an exciting year for me in that my book, yes, my book, Nurse, The Guide to Empower New Nurses, definitely, it was published in August. Many of my colleagues have obtained their copies. Others have not as yet. Young nurses, many young nurses have gained their copies also. Other individuals who are not nurses have also obtained their copies. So I'm still excited. And there are others who are planning on getting their copies. I was at an induction in November, and there it was. Many young nurses, they got their copies. Senior nurses, instructors, educators, they got their copies. And they are excited to share the information. So whether you're a seasoned nurse or you're a new nurse, you can have your copy. For the seasoned nurse, it can be a refresher. One of my seasoned nurse said that to me. Miriam, I was so refreshed by it. And other individuals who are not nurses, go on Amazon and you'll see. They have made some tremendous reviews of how impactful the book has been to them. So let me encourage you to get your copy. Also, individuals who have been interviewed on this program, they have had their copies and they're so excited. And they're also giving copies to others as a gift. So if you choose to read one, you can get one for yourself. If you choose to share one, you can share it with someone, a copy also. And this definitely will have ripple effect in that when there's transformation in the nurses' lives, it can impact the care given. Also, the patients will receive better care, and so on and so forth. The patient themselves can also get a copy because there's so much information compact that is in this book that will help others. Okay, so today I'm going to talk on communication in different age groups. And if you know well, I just had twins. My daughter has twins, and a boy and a girl. And I was there. But interestingly, just to let you know, that as we communicate with different individuals and different age groups, we have to have different approaches. So at this time, I'll say something a little on the infant. So infant, that's from birth to 12 months. And let me let you know this from my experience, definitely recently, try to meet the infant's needs as quickly as possible. If they are wet, if they are hungry, you're just going to do this as quickly as you possibly can because they will let you know that they need immediate care. They'll cry out, and nonverbal, we have to hug them, we have to touch them, we have to hold them, and of course, we have to stroke them. We have to give them a little rocking here, a little comforting, and that's reassuring to the infant. And some of them, in my colloquial way of saying, they will say they love their hand. So if you're not careful, you can spoil them in that you keep them in your hand, and when you're ready to put them down, they don't want to go, and they will make noise for that. So we have to be careful how we do that. But of course, we're going to love and we're going to embrace and we're going to touch. But we have to sometimes limit how much we hold them because when you hold them too much, sometimes you can't put them down. And I'm guilty of that. Okay. We have to speak softly to them. And of course, we have to smile with them. And we have to try and maintain a routine for them. Of course, we feed them on demand, but remember that sleeping time, we have to try and let them create that schedule for them, because sometimes they will. So you have to be mindful of that, making sure they get enough sleep. Some will sleep a lot, but some will not. So you have to make an adjustment for that and educate the parents. So you have some new parents and they need that little extra help. So whatever support you can give to them, let's do that. So I'm talking about the age group from birth to like 12 months. But I'm telling you, just immediate, like in the month and a half, they need that extra cuddling and observation, because sometimes after you just feed them, you make sure you have them, you let them burp. It's so important. And talking from experience now, if they don't burp, sometimes as quickly as soon as, if you don't put them down immediately after flat, because they definitely, they would say, they vomit and all of that stuff. And remember, their organs are still being developed slowly. So, and the transition from inside to outside, it's going to take some time. So the digestive system, the respiratory, just think about them and how they're fragile, they're tender, they're loving, and you have to give them those little hugs, and it's hard to describe. But when you do have a bit, now I have twins. So once you fix one, you care for this one, you start seeing the other one starting, and you put one to bed. By the time you put one to bed, the other one start crying. One start puking, the other one starts to, and so mom and dad need some extra support. And those of you who have had twins, you know what it's all about. It's not a play. It's loving and nice to say, yeah, twins, yeah, but they need care. And we have to put that special effort out for them. And I have done that, and I enjoy doing that as a grandma. I really do. I really, really, really do. I really do. I don't want to spoil them. They would say. But remember, they need that extra right there. It's two of them. And the demand sometimes, same time. So that's what I have to say today. And just think of the little ones that as you communicate with them, it's different from an adult. A different approach will have to be for the adult. The little ones, they can't talk, but they let their voices be heard. So pay attention before they really get angry. If they need their feed, before they start crying and get into that sort of tantrum, like, observe that and feed them on cues, on demand. Some will take a little longer time, but others, they need their food now, or they need to be changed now. So we have to be quick with that, paying attention to them. Thank you so much for listening. And it's just practical. And all the best with your little ones. And just continue to give the best care that they need. I'm Dr. Miriam Smith. You can connect with me and you can connect with me definitely on YouTube, Miriam Amanda Smith. And if there are some consultation that you need to have in communication, mindset, in basic EKG, of course, you can connect with me. Go on my website, definitely, Miriam Amanda Smith, Empowering New Nurses, and you will find where you can connect with me, make a date on my calendar, and this would be just great. I need to have you. If you're uncomfortable, I need to have you, because meeting with me and going through stuff can make a difference in your nursing journey. Thanks. Thank you.